Bonjour, good morning, bon lundi. Je suis Boris Proulx, je serai le modérateur de cette conférence de presse. I'm Boris Proulx and I'll be moderating this press conference. We have a lot of people on stage today. First off, Jean-Yves Duclos, Minister of Health. Through the phone line or Zoom, Omar Alghabra, Minister of Transport. Nous avons Dominic LeBlanc, Ministre des Affaires intergouvernementales. Mendicino, Ministre de la Sécurité publique. Mona Fortier, Présidente du Conseil du Trésor. Et bien sûr, Dr. Howard Njoo de l'Agence de la santé publique du Canada. So the ministers will have brief remarks, after which I will take questions first on the floor and then via Zoom. Ministers, you have the floor.
Good morning. Bonjour à tous et à toutes. Before starting, I would like to say that my thoughts are with everyone who's been affected by Hurricane Fiona. Avant de commencer, moi, j'aimerais vous dire que mes pensées sont avec tous et toutes qui sont affectés par l'ouragan Fiona. Nationally, COVID-19 weekly case counts have increased slightly over the past week, which may be an early sign of resurgence. Regional variation remains, with some indicators, such as wastewater signals, also showing local resurgence in some areas. While deaths are decreasing and ICU numbers remain low, numbers of people in hospital are slow to decline and remain elevated. With contact rates increasing and more time spent indoors this fall, we could see continued growth of this trajectory. However, we are going into this fall and winter season with a very different scorecard. We now have a significant advantage in terms of infection and vaccine-acquired immunity, as well as having bivalent vaccine formulations that can further bolster our protection. At the same time, we need to be mindful of our vulnerabilities, since we know that immune protection decreases over time. If it has been 6 months or longer since an infection or your last vaccine dose, anyone 12 years or older and eligible for a COVID-19 booster can step up to increase their protection. Keeping up to date with COVID-19 vaccines is particularly important for individuals at high risk for severe outcomes. Bivalent COVID-19 vaccines, which target more than one strain of COVID-19, are expected to provide stronger and broader protection. Protecting our health starts with keeping all of our recommended vaccines up to date and adding layers of personal protection, including hand washing, wearing masks in poorly ventilated indoor or crowded settings, and staying home if you have symptoms to prevent spreading infection to others. À l'échelle nationale, le nombre de cas de COVID-19 par semaine a légèrement augmenté au cours de la dernière semaine. Ceci peut être un signe précoce d'une recrudescence. Il existe encore des variations régionales et certains indicateurs, comme les signaux dans les eaux usées, démontrent également une recrudescence locale dans certaines régions. Bien que le nombre de décès baisse et que celui des personnes aux soins intensifs demeure faible, le nombre d'hospitalisations diminue lentement, mais reste élevé. Comme le taux de contact augmente et que nous passons plus de temps à l'intérieur pendant l'automne, nous pourrions constater une hausse continue de ces chiffres. Cependant, à l'approche de l'automne et de l'hiver, notre bilan est bien différent cette année. Nous avons maintenant un avantage important du point de vue de l'immunité conférée par les infections et les vaccins. Nous disposons également de formulations de vaccins bivalents qui peuvent renforcer notre protection. En même temps, nous devons être conscients de nos vulnérabilités puisque nous savons que la protection immunitaire diminue au fil du temps. Si elles ont été infectées ou si elles ont reçu leur dernière dose de vaccin il y a 6 mois ou plus, les personnes de 12 ans et plus admissibles à une dose de rappel du vaccin contre la COVID-19 peuvent agir en vue d'augmenter leur protection. Garder une vaccination à jour contre la COVID-19 est particulièrement important chez les personnes qui présentent un risque accru de complications graves. Les vaccins bivalents contre la COVID-19 qui ciblent plus d'une souche de la COVID-19 devraient renforcer et élargir la protection. Pour protéger notre santé, il faut commencer par garder notre vaccination recommandée à jour et continuer de prendre des mesures de protection personnelle, comme se laver les mains, porter un masque dans les espaces intérieurs ou des lieux bondés, mal ventilés et rester à notre domicile en cas de symptômes pour éviter d'infecter d'autres personnes. Merci. Thank you. Miigwech.
Merci, merci beaucoup, Dr. Njoo. Good morning, bonjour. As you know, the Prime Minister will be updating you later this morning on our work to help Canadians in Atlantic Canada and in Quebec in the aftermath of Hurricane Fiona. Throughout this pandemic, our government has been focused on the advice of our public health experts, of doctors, with one objective in mind: keeping Canadians healthy and safe. As the pandemic evolves, so do our public health measures. Grâce aux efforts des Canadiens, dont l'immense majorité sont allés se faire vacciner lorsque leur tour est venu, la situation sanitaire au pays s'est grandement améliorée. Des défis demeurent par contre et nous devons rester vigilants, mais tout en suivant les recommandations de la Dr Tam et du Dr Njoo et de leurs équipes, nous jugeons que nous sommes maintenant en mesure de modifier notre approche à nos frontières internationales. Et mon collègue, le ministre de la Santé, Jean-Yves Duclos, sera évidemment en mesure de vous en dire plus. Et Jean-Yves, je te passe la parole tout de suite.
Bonjour à toutes et à tous. Good morning, everyone. Merci, Dominique, pour ces remarques. J'aimerais aussi remercier mes autres collègues, les ministres Fortier, Alghabra, Mendicino, ainsi que le Dr Njoo, d'être présents avec nous ce matin. As we have mentioned in the past, and as Dr Njoo just reminded us, we were and we are in a much better position today than we were in 2020. That is in large part due to the vaccination efforts of Canadians and to the observance of public health measures since the outbreak of the pandemic. Back in 2020, our government reacted quickly to the arrival of COVID-19, and we did not hesitate to commit direct federal funding to protect Canadians, which included $6 billion for PPE and medical equipment, $15 billion for vaccines and therapeutics, $5 billion for rapid tests and testing overall, $13 billion in other public health support, for a total of close to $75 billion in protecting the health and safety of Canadians. These investments allowed Canadians to access widely the tools needed to help slow the spread of COVID-19, including the vaccines and treatments needed to keep people from getting seriously ill. More than 85% of Canadians have received at least 2 doses of vaccines. All Canadians aged 6 months and older now have access to a safe and efficient vaccine. Further, fall booster vaccine campaigns have begun across the country, which will further increase protection. Moderna's new bivalent vaccine, which specifically targets Omicron, is now offered to all Canadians, adults everywhere in the country. Another good news is that 40% of Canadians say they want to receive a booster dose this fall, and another 40% are considering it. This is crucial. Modeling by the Public Health Agency of Canada indicates, for instance, that if Canada were to increase its rate of third doses from 60% to 90%, then it would also reduce by 90% the number of hospitalizations that we would otherwise see later this fall or early next year. Again, it is important that we stay up to date with our vaccination and get the booster shots that we are eligible to and protect themselves and those around us. As Dr. Njoo said, immunity fades over time and a booster shot brings it back up. Immunity is like a phone battery. After some time, it needs to be recharged. So folks, if it's been more than 6 months since your last dose, it's time to recharge your battery and get a booster shot. High vaccination rates and Canadians' strong adherence to public health measures have helped push us to an enviable position. A recent study published by the Journal of the Canadian Medical Association reviewed Canada's COVID-19 response against a group of 10 comparable countries like Belgium, France, Germany, the United States, and Italy. The study found that most other countries had 2 to 3 times Canada's number of infections per capita. Our death rate was also the second lowest of the group, behind only Japan. Further to that, the modeling recently published by PHAC suggests that without public health measures or vaccination, Canada could have seen up to 2 million hospitalizations and 800,000 deaths since the start of COVID-19. That contrasts sharply to the much lower 150,000 hospitalizations and 40,000 deaths we have seen so far. 15 times fewer hospitalizations and 20 times fewer deaths. That is the outcome of Canadians having made the right choices during the pandemic. Permettez-moi maintenant de traiter des mesures à la frontière dont le décret expire le 30 septembre. Ces mesures frontalières d'urgence ont été mises en place pour réduire le risque d'importation et de transmission au pays de la COVID-19 et de ses nouveaux variants. Nos mesures frontalières ont toujours été fondées sur la prudence, les données disponibles, les considérations opérationnelles et la situation épidémiologique au Canada et à l'étranger. Aujourd'hui, sur la base des données accumulées au cours des derniers mois, nous annonçons qu'à compter du 1er octobre 2022, le gouvernement canadien supprimera toutes les exigences frontalières relatives à la COVID-19 pour tous les voyageurs entrant au pays. Cela comprend la suppression de toutes les exigences fédérales en matière de tests, de quarantaine et d'isolement, ainsi que la soumission obligatoire d'informations sanitaires dans ArriveCan. Today, based on the data accumulated over the last few weeks and months, we are announcing that the Government of Canada will not renew the order in Council that expires on September the 30th and will therefore remove all COVID-19 border requirements for all travelers entering Canada. This includes the removal of all federal testing, quarantine, and isolation requirements, as well as the mandatory submission of health information in ArriveCan. Le gouvernement canadien maintiendra la capacité de rétablir certaines mesures frontalières au cas où elles seraient nécessaires à l'avenir pour protéger les Canadiens contre des nouveaux variants préoccupants de la COVID-19 ou d'autres menaces émergentes pour la santé publique. The Government of Canada will maintain the ability to re-establish certain border measures should they be required in the future to protect Canadians from the importation of new variants of concern or other emerging public health threats. Les résultats des tests frontaliers effectués par l'Agence de la santé publique au cours des derniers mois ont démontré que les importations de cas de COVID et de ces variants n'influencent plus significativement l'évolution de la pandémie au pays. Les niveaux élevés de cas et d'hospitalisation sont largement expliqués par la transmission intérieure du virus, y compris par les taux de vaccination à jour. Permettez-moi d'ajouter aussi que la conseillère scientifique en chef du Canada, la Dr Mona Niemer, a mis sur pied cet été un groupe de travail sur le syndrome post-COVID-19, aussi connu comme la COVID longue. Le groupe de travail de la Dr Niemer produira un rapport bientôt cet automne qui fournira un cadre pour comprendre et combattre la COVID longue. Une des façons de se protéger des effets parfois sévères et durables de la COVID longue est évidemment de garder sa vaccination à jour. En terminant, nous continuons d'encourager les Canadiens à agir avec prudence en ce qui concerne la COVID-19. La prudence continuera aussi à guider nos actions en tant que gouvernement. Les prochains mois vont être critiques. Nous allons nous retrouver davantage à l'intérieur. D'autres maladies respiratoires que la COVID vont aussi être de retour. As we move indoors this fall and winter, we do expect an increase in COVID-19 cases and other respiratory viruses. Mais en restant à jour dans notre vaccination et en faisant preuve de comportement prudent, notamment le port de masques en fonction des circonstances, nous continuerons à protéger notre santé, celle de nos proches et celle de nos travailleurs de la santé qui en ont bien besoin. Mes collègues et moi souhaitons, en terminant, aussi remercier les Canadiens qui continuent de faire leur part pour protéger leurs familles et ceux qu'ils aiment. Mes collègues et moi souhaitons également remercier les agents de santé publique et tout le personnel de première ligne à nos frontières terrestres et aériennes qui ont travaillé sans relâche depuis mars 2020 pour protéger la santé et la sécurité de toutes et de tous. Thank you. I will now turn it over to Minister Alghabra. Omar? Omar.
Thank you, Jean-Yves. Good morning, everyone. Bonjour à tous. I'd like to begin by acknowledging that I am doing this announcement virtually from Montreal, which has traditionally been a place of exchange and meetings for several First Nations. I also want to start by saying a few words about Hurricane Fiona, which hit eastern Quebec and the Atlantic region last weekend. My thoughts are with all those who have been affected. Transport Canada is working with the other departments involved and our partners to support local communities and assess the impact on our transportation infrastructure. Back to today's announcement, we've always maintained that the extraordinary measures we introduced at our borders and on airplanes, trains, and boats were temporary, and that we would adjust them as situation changes. So today, we're doing just that. As my colleague, Minister Duclos, just said, starting on October 1st, we are removing COVID-19 measures that remain at the border. The factors that allow us to remove these border measures also allow me to announce that Transport Canada is removing existing travel requirements. This means that as of October 1st, travelers will no longer be required to undergo health checks for travel on air and rail or wear masks on planes and trains. À partir de 1er octobre, les voyageurs ne seront plus tenus de se soumettre à des contrôles de santé pour voyager, porter des masques dans les avions et les trains. For international flights to Canada, airlines will no longer need to review the vaccination status of foreign nationals, confirm travelers have submitted the required information in ArriveCan, or ensure compliance with the pre-entry testing requirements. Similar changes will also apply to passengers traveling by cruise. Passengers and crews on board cruise ships will no longer be subject to vaccine requirements or testing before they board a vessel. Transport Canada will continue to provide guidance to help cruise ship operators establish health and safety protections. And while wearing a mask on a plane or train will no longer be mandatory, we strongly encourage travelers to continue doing so. Nous encourageons le voyageur à continuer à porter un masque. I want to take this opportunity to thank everyone in the travel industry for their hard work to implement these policies over the past couple of years. It's not been easy, but everyone rose to the occasion. Un grand merci à l'industrie. I've said it before. We're able to do this because tens of millions of Canadians rolled up their sleeves and got vaccinated. We've all worked together to follow the guidelines, get vaccinated, and protect one another. And now we're taking another step to returning to the normal travel that connects families, workers, and our communities. Merci, thank you. And now I'd like to pass the mic to my colleague, Minister Mendicino.
Good morning, bonjour tout le monde, and let me begin by attributing myself to colleagues' comments about Hurricane Fiona, and especially to those who have been impacted by it. The federal government is working around the clock to provide whatever support that we can for them. And in the meantime, obviously, our thoughts are with them. And as you heard Minister LeBlanc say, more information will be coming this morning. Alors que les Canadiens ont collectivement fait face aux défis de COVID-19, les frontières de notre pays ont été la ligne de front du Canada. Since the pandemic first arrived on our doorstep, we moved quickly and decisively to take action at the border and protect Canadians. In the early days of the pandemic, this meant closing our borders and strict quarantines. As the situation evolved and improved, thanks to a world-leading vaccination effort, so has travel, with measures in place to ensure that it happens responsibly and safely. Over the past year, business, tourism, and visitors have all returned to our shores in strong numbers, and Canadians are traveling again. Over 38 million entries in total year-to-date in 2022, which is more than double the total number of travelers we saw in all of 2021. And this is great news for the economy, for trade, for jobs, and for personal travel. And we want to keep that momentum going. So today, we're taking another significant step. As of October 1st, 2022, travelers entering Canada will no longer be required to use ArriveCan in any mode of travel, air, land, or sea. This decision is as a result of the removal of all COVID-related health measures at our borders. Going forward, use of ArriveCan will be optional, allowing travelers who so choose to submit their customs declaration in advance at major airports. Les voyageurs entrant au Canada ne seront plus tenus d'utiliser ArriveCan grâce à la suppression de toutes les mesures sanitaires liées au COVID-19 à nos frontières. L'utilisation de l'application sera totalement facultative, permettant aux voyageurs qui le souhaitent de soumettre leur déclaration de douane à l'avance dès les principaux aéroports. Since its inception, ArriveCan has been linked to mandatory health information, including vaccination status, that travelers have submitted when entering Canada. ArriveCan will now become voluntary for those who want to save time at airports by uploading documents in advance. Alors que nous nous éloignons de la pire phase de pandémie, nous pouvons recourir à l'application en tant qu'outil facultatif pour améliorer et accélérer les déplacements des personnes qui choisissent d'utiliser. Ce service contribuera également à assurer la sécurité des Canadiens en permettant à nos agences des services frontaliers de se concentrer sur les voyageurs qui présentent un risque élevé. The Advanced Declaration feature is already available at Toronto Pearson, Vancouver, and Montreal Trudeau airports. In fact, 1/3 of travelers are currently taking advantage of it. In the coming months, we'll expand this option to be available at Calgary, Edmonton, Toronto City, Winnipeg, Halifax, Quebec City, and Ottawa airports. L'Agence s'engage à continuer d'améliorer l'application en y ajoutant des informations utiles et des outils libre-service. Alors que nous nous remettons de la pandémie, le Canada modernise ses frontières pour offrir à tous une expérience plus agréable et efficace et de déplacement plus rapide. We'll continue to embrace technology to make crossing the border more efficient while never compromising the health and safety and security of Canadians. I want to thank our CBSA officers for everything they've done over the past 2.5 years. Grâce à votre excellent travail, vous facilitez les déplacements, soutenez notre économie et protégez nos collectifs. Finally, I want to thank Canadians. Thanks to you, we've emerged from this pandemic stronger than ever. And indeed, that is one of the main reasons why we've been able to take this important decision today. And with that, I will now pass the mic over to Minister Fortier.
Merci. Thank you, Minister Mendicino. Bon matin à toutes et à tous. Merci d'être avec nous aujourd'hui. Every step of the pandemic, the federal government has listened to doctors and science experts to make sound decisions and focus on protecting Canadians. Les politiques sanitaires changent au fur et à mesure que la pandémie change. Les politiques sanitaires ne changent pas à cause de la politique. It's not politicians who got us here today. It's Canadians who rolled up their sleeves to get vaccinated. You did your part. You got Canada to a better place with high vaccination rates and lower hospitalization rates and widely available vaccine boosters, rapid tests, and treatments. Les mesures frontalières qui ont été introduites précédemment ont toujours été considérées comme temporaires, tout comme les mesures introduites dans la fonction publique. La vaccination obligatoire des fonctionnaires a rendu nos lieux de travail et nos communautés plus sécuritaires. Et cela était nécessaire pour protéger les Canadiennes et les Canadiens. Suspending the vaccination requirement last spring for public servants was based on the latest scientific evidence, and we will continue to follow Health Canada's advice to protect health and safety in our workplace. Pour terminer, je tiens à souligner que les données scientifiques montrent clairement que la vaccination reste le moyen le plus efficace de nous protéger, ainsi que nos familles, nos communautés et notre économie. Et nous vous encourageons fermement à rester à jour dans votre vaccination, de rester à la maison si vous contractez la COVID et à continuer à porter des masques lorsque nécessaire. And now we'd like to take your questions. On peut prendre la période de questions maintenant. Merci.
Merci beaucoup. Thank you. We have quite a few questions, so I appreciate if you can answer them all. Of course, time is running, and I'm told that 9:30 is our deadline. So we will start with the questions on the floor. If you are on Zoom, please raise your hand with the raise hand function now, so we could take them after. Si vous êtes sur Zoom, vous pouvez utiliser la fonction lever la main et nous allons passer à Zoom après quelques questions ici dans la salle. So we will start with Laura Hausman from Canadian Press.
I want to start by asking you about the Quarantine Act. COVID-19 cases, the Quarantine Act would still apply to them. Can you please explain what advice you have for travelers and what that will mean for people who are arriving in the country who may have COVID or may have COVID symptoms?
Thank you for the question. And as you heard, the order in council expires on September 30th. It will not be renewed, which means that we come back to the earlier rules around quarantine and border measures. Border agents and public health officials have the ability to keep screening people and advise them on the right things to do if they happen to be infected with COVID-19 or other diseases. And in the case of COVID-19, if people enter Canada and find out that they have been infected with COVID-19, then they will need to follow local public health measures.
Thank you. You also mentioned, Minister, that you sort of reserve the right to bring border measures back under certain conditions. Can you speak about what kind of border measures you would consider reinstating and under what conditions?
Two things on that. The first one is that the absolute first responsibility of a government is to protect the safety of its citizens. That is non-negotiable. Everything that needs to be done in the context of public health or public safety emergencies to protect the safety of people needs to be done by a responsible government. The second thing is that we have learned over the last 2 years and a half the type of measures that can work and the type of measures that do work but need to be to come to an end, and as we are announcing today. And we will therefore leave open all possible options when it comes to protecting the safety of Canadians in a world, in a COVID-19 world, which in particular we know has been generating all sorts of surprises over the last 2 years and a half. So we need to be prepared. We'll be prepared. Obviously, we have no hope to reintroduce some of these measures, but if we need to protect the safety of Canadians, we will have to.
Merci. Louis Blouin, Radio-Canada.
Bonjour, messieurs. Depuis des mois, vous dites que les tests de dépistage aléatoires sont nécessaires dans les aéroports pour faire la traque des variants qui arrivent de l'étranger. Or, là, à partir d'aujourd'hui, il semble que ce n'est plus nécessaire. Vous dites que vous prenez cette décision-là parce que les cas et les hospitalisations sont en baisse. Or, ils sont en baisse significative depuis mai dernier. Depuis des mois, vous nous dites que le masque est important pour prévenir les infections. Or, là, aujourd'hui, il semble qu'il ne l'est plus parce que vous retirez cette obligation-là. Alors, ma question, comment pouvez-vous regarder les Canadiens dans les yeux ce matin et leur dire que cette décision-là, elle est fondée dans la science, alors que peut-être qu'il y en a qui se demandent si elle est plutôt fondée dans des raisons politiques ou liées peut-être aux attaques d'un certain chef conservateur?
Merci pour la question. Deux choses rapides. La première, c'est que le COVID-19, c'est toujours avec nous. Si on va dans les hôpitaux au Canada, il y a entre 4 000 et 5 000 personnes qui sont hospitalisées avec la COVID-19. Ça, c'est très proche du record de niveau d'hospitalisation qu'on avait avant Omicron. Donc, la COVID, elle est encore là et elle a malheureusement un impact sévère sur des milliers de Canadiens et entre autres ceux qui sont hospitalisés, évidemment. La deuxième chose, c'est qu'au cours des derniers mois, en raison des informations qu'on a pu récolter à la frontière, on a pu constater que l'importation de variants et de nouveaux cas de la COVID ne contribuait plus à l'évolution de la pandémie. L'évolution de la pandémie est celle qu'on va voir au cours des prochaines semaines et des prochains mois. Ça va être largement mené, expliqué et influencé par la transmission intérieure au pays. Et c'est pour ça que, comme le docteur Njoo l'a dit, et comme tous les docteurs et les scientifiques le répètent depuis déjà plusieurs mois, l'accent doit être sur la vaccination à jour. C'est la méthode qui va nous permettre de passer à travers les prochains mois critiques. C'est là qu'il faut investir nos énergies. Et c'est pour ça qu'on est tous ici aujourd'hui pour encourager les Canadiens à continuer de faire les bons choix, d'aller chercher ce vaccin bivalent qui est plus efficace et encore plus efficace contre la COVID-19, en particulier parce qu'il cible le variant Omicron. Aller chercher ce vaccin qui est maintenant disponible partout au pays pour se protéger eux-mêmes, mais protéger aussi les autres contre la transmission que la COVID-19 continue à générer dans nos familles et dans nos communautés à travers le pays.
Si vous me permettez, Louis, juste d'ajouter à ce que Jean-Yves a bien dit, vous vous rappellerez bien qu'au début de la pandémie, il n'y a pas très longtemps, les conservateurs ont dit que les Canadiens n'auront pas de vaccin avant 2030. M. Poilievre continue de s'opposer et de résister à ces vaccins, comme on a entendu du Dr Njoo et de Jean-Yves, qui ont sauvé littéralement des milliers de vies au Canada. Alors, nous considérons pas ça comme un leadership responsable ou sérieux. Et nous avons toujours écouté les médecins, les scientifiques, et nous n'allons pas commencer à écouter ce genre d'irresponsabilité-là.
Sur la question du masque spécifiquement, on nous prévient depuis quelques semaines d'une possible 8e vague. Les gens retournent à l'intérieur. Il est possible que le virus recommence à circuler. Pourquoi ne pas avoir maintenu l'obligation du masque? Parce qu'on sait qu'il est efficace quand même pour prévenir la propagation, particulièrement dans des espaces qui sont fermés.
Deux réponses. La première que je vais fournir, la deuxième que Dr Njoo, vous allez vouloir peut-être compléter sur l'aspect plus scientifique. Donc, c'est une décision, évidemment, qui est prise par le ministre Alghabra dans un contexte où, comme je le disais, on s'aperçoit que la transmission des variants et de la COVID, c'est une transmission essentiellement intérieure, domestique. Donc, c'est là que les efforts doivent être mis. Évidemment, le port du masque continue d'être fortement recommandé dans les avions et dans les trains, même si on sait que ce n'est pas là que la majeure partie de la transmission s'observe. Ce n'est plus dans un cadre coercitif parce que, comme on a entendu des compagnies aériennes et des gens qui travaillent dans les avions, ça devient plus difficile de mettre en place la coercition dans ce genre d'environnement. Des agents, des hôtesses de l'air, des agents dans les avions et en dehors des avions font face de plus en plus à des attitudes dures et négatives qui leur rend la vie difficile. Mais on sait que la plupart des gens vont continuer à porter le masque dans ces environnements parce qu'ils savent que dans des environnements comme ceux que vous avez décrits, des environnements où il y a beaucoup de gens, mais la transmission, évidemment, se fait plus facilement que dans les environnements autres. Et Dr Njoo peut-être d'un point de vue scientifique, peut-être valider ce que Louis semble suggérer, c'est que le port du masque continue à être efficace.
Oui, oui, merci, Monsieur le ministre. Je peux seulement ajouter que la science est claire. Le port de masque reste encore un moyen de protection personnelle très efficace pour se protéger, mais aussi protéger les autres, pour prévenir la transmission du virus. Donc, maintenant, je pense que le changement, c'est plus une obligation, mais c'est plus une recommandation. Donc, je pense que j'espère que les Canadiens, les Canadiennes considèrent que c'est une choix, une décision éclairée pour se protéger, protéger les autres. Pour moi, c'est clair que si on est dans un contexte, un milieu, un endroit bondé aussi avec beaucoup de monde, peut-être à l'intérieur avec peut-être pas une bonne ventilation, c'est toujours une bonne idée de toujours continuer de porter un masque.
Annie Bergeron, Oliver, CTV.
Would you like to respond in English before I ask my question? Is that okay? Yes, please.
Now, as you heard from Dr. Njoo, wearing a mask is still a very efficient way, not only to protect ourselves, but protect others around us. And the strong recommendation that PHAC is making is for passengers on trains and on planes. And I think that Minister Alghabra, I'm speaking on behalf of Omar, but I think Omar, what I'm saying aligns with what you also are saying, is that this should still be a relatively easy measure to take to protect against COVID-19 infecting ourselves or infecting others. This being said, we're moving away from a coercive environment, which has created pressures and difficulties for air travelers and air workers in particular. Air workers have faced over the last few weeks. We have heard from the industry difficulties in making that coercive measure being followed by all travelers. So we believe that most travelers will continue to wear those masks, but there will be some travelers who will choose not to do so, and that's all right.
Thank you very much. My question is going to be for Dr. Njoo as well as you, Minister Duclos. Last week, the U.S. president was quoted as saying, quote, "the pandemic is over." Today, the federal government is removing the last of the COVID-19 restrictions. Do you agree with his assessment?
And that's a fair question. The answer is that if anyone has doubts as to whether COVID-19 still exists, I would invite that person to visit a hospital anywhere in Canada. We have between 4,000 and 5,000 people hospitalized every day with COVID-19. That puts a very heavy burden on our hospital system. It's close to 10% of hospital capacity, which is currently used for looking after people with COVID-19. We also know that healthcare workers are very tired. They are exhausted. They have left in large numbers. And worryingly, many of them think of leaving in even larger numbers over the next months in Canada. We need to care for our healthcare workers if we want them to care for us. So we need to protect ourselves and to protect others by being vaccinated against COVID-19, taking advantage of this great new formulation for which we were one of the first countries in the world to have access to. And it's available everywhere in Canada. And we know that Canadians have done extremely well with 2 doses. We need to do, and we want to do equally well with being up to date in terms of vaccination. So I invite everyone, every Canadian listening to us, to do as well as we've done with 2 doses. And if we succeed in doing this, we'll reduce very significantly the burden on hospitals and importantly on healthcare workers, leading to the end of the fall and early winter.
It's going to come out for me. Personally, what I would say is that I think we're past what we call the acute phase of the pandemic, but certainly the pandemic's not over. It'll be obviously the virus with us for quite some time, and I think that we need to continue to manage and as the virus continues to evolve. I think we should be optimistic. I think the Director General of the WHO also had a very optimistic message. Sort of the end is in sight, but we can't, as they say, you can use all the analogies you want. take your foot off the gas pedal, or, as a marathon, if you see the finishing line, you don't stop, you keep running even faster. So I think we want to be optimistic, but all of the tools at our disposal, we need to continue to push hard, keep our vaccine coverage rates high, keep up with your vaccination, continue to wear, I would say a mask in certain contexts, certainly if you're in a indoor spaces with poor ventilation, if you're in crowded places. And I think as people go out, I recognize, and all of us, including myself, we want to go out and sort of have those social contacts. And I think people just need to be, I think, as well thoughtful about the choices they make as they want to go out and reconnect with friends and family.
And my follow-up question goes to that as well. You just mentioned that there are still thousands of people hospitalized, that Mr. Njoo, Dr. Njoo, you talked about in your opening remarks that cases look like they're climbing. So given all of these, why remove these measures right now? Why not just keep them until this fall wave and potentially winter wave, as Dr. Njoo had kind of hinted at, is over?
And the reason, as I mentioned earlier, is because over the last few weeks and months, we have seen with the data that we have been able to collect that the contribution of the importation of cases and variants into Canada, that contribution to the epidemiology and to the evolution of the epidemiology is minor. It's insignificant. What explains COVID-19 now and what will explain COVID-19 in the next few weeks is the domestic situation. That's where we need to focus our efforts, and that's why, as we are doing today, we're encouraging Canadians to keep making the right choices. Those choices have saved the lives of hundreds of thousands of people in Canada. One estimate is about 200,000 lives have been saved in Canada because of vaccination. We would have seen 20 times the number of deaths if Canadians hadn't followed public health measures and had not been vaccinated in so high numbers. So these are the right choices that people made over the last 2 years and a half. We want to continue making those right choices, and those choices are essentially driven and observed internally within Canada.
Merci. Thank you. David Aiken, before I leave you the mic, I just remind you to keep the answers and the questions short because we have many questions and really little time. David.
Question from Minister Mendicino. Just I wonder if you could speak to the operational complexity of taking all these measures off. We saw a lot of hiccups with our travel system as new measures were introduced. We saw lots of hiccups when people started traveling again. When these come off, is this going to go smoothly? Do we need more funding, more people? Just wondering about that.
Well, that is certainly the goal, and one of the things that we've done is worked very closely with colleagues across various line ministries, including Minister Duclos at Public Health and Minister Alghabra at Transportation, to ensure that as we make modifications to our policies, whether it's through changes to the OICs or to our policies, that we are aligning that to operationalization as it relates to our platforms and training. I think to be direct about it, now that ArriveCan will be optional, that will actually be a more straightforward change because it will be at the choice of the traveler to use that technology, and all other restrictions will be lifted. So in a way, I think the update to our frontline CBSA officers will be more straightforward that way.
And just maybe just you personally, will you continue to use ArriveCan? Will you choose to be an ArriveCan user for your travel?
Well, I've uploaded it, and I know that there's various anecdotes out there. Some people who were very frustrated, and others who have said that their experience was actually quite smooth. And I do think that consistent with the principle that we've used in using technology on a go forward, I think it's important that we are always leveraging new innovations so that traveler experience can be smooth and effective. And for those Canadian travelers and for those travelers abroad who do choose to use this application, we'll use their experience to continue to improve that platform, because ultimately we want people to be able to travel smoothly and effectively and efficiently.
Rafi Boudjikanian, CBC.
Thank you. I wonder how concerned you are about mixed messaging to Canadians on the pandemic being over or not. I see only Dr. Howard Njoo wearing a mask today, and he's the only person here who's not an elected official. You talked about, rising case counts. At the same time, Minister Duclos, you're saying the pandemic is not over and anyone who thinks it is should walk into a hospital. So what are Canadians to take away from how careful you're telling them to be right now by lifting these measures?
A couple of messages that my colleagues might want to add. First, in making those decisions, we are mindful of the challenges and the costs that border communities have been facing over the last few weeks and months. It's been hard for them, and my colleagues and all members of our caucus have felt that and have listened to them. And we have therefore taken those costs and challenges into account in making the decision. But that decision, again, was driven by the evidence that we have seen over the last few weeks and months, which is that the transmission and the cost of transmission of COVID-19 on our healthcare workers, hospitals, and including those patients that have seen backlogs in their surgeries and treatments over the next 2.5 years. So these costs are now almost entirely driven by domestic transmission of COVID-19. That's where we need to invest our energies. And that's why, therefore, public health measures that we all know now and being up to date in terms of vaccination, that's why that matters so much. If we haven't had a COVID-19 vaccine in the last 6 months, we need to get one. It's like a phone battery. Our battery is now almost dead. We need to recharge that battery and to be up to date in terms of vaccination. That's the key action which individually we can take. It comes with no cost. All of those vaccines are distributed free of charge by the federal government. No cost to anyone and no cost to provinces and territories. It takes a little time, and it obviously requires moving to a place, so it's not completely free of cost, but it's very cheap time-wise and absolutely cheap from a cost perspective. However, it makes a big impact on the pandemic. A hospitalization costs on average $23,000 when it's related to COVID-19. That's a lot of cost. So if we can collectively keep doing the right thing and protect each other, we are going to keep doing collectively very well compared to many other countries.
Follow up, Rafi?
Just wondering about ArriveCan and its continued use even as optional. What assurances can you provide Canadians about their private data remaining in safe hands, especially for the ones who decide to get rid of it now?
Well, the most assurance I can provide them is that we will continue to abide by the law, including their rights under the Charter, and we work very closely with the Privacy Commissioner to ensure that not only ArriveCan, but all of our platforms and our policies are done in a way that respects privacy rights, but also is able to be, that information is able to be used in a way that protects the health and safety of Canadians.
I am told that we have time for perhaps one last question. I'm going to zoom to Ryan Tumilty from the National Post.
Yeah, good morning. Good morning, ministers. I wanted to ask, it seems like based on the leaks that happened last week, that this decision was made last week. I'm wondering why it took as long as it did to actually announce it. Given the big impact that this has on the border, on travelers, on airlines, on airports, why the delay there?
Well, I would say that there is no delay. This is being announced in advance of the expiry of the current OIC, which expires on September the 30th. We have made those announcements in the past in anticipation of those dates that for which orders in council were expiring.
And then maybe just as a follow-up, are you still planning to, prosecute people who were issued fines for not using ArriveCan? Do all those fines still stay in place?
That is a decision made by the justice system and obviously independent of political interference. I would recommend, and I think we would recommend that you direct this question to the Minister of Justice.
Would you have time for one last question, ministers? Because it's 9:30, and as per the norm, we take at least the same number of questions at the same time as the statements. So perhaps I'll go to Olivier Ferron-Boissé from TVA.
Oui, bonjour. Monsieur Duclos, vous disiez plutôt que vous pourriez réintroduire d'autres mesures dans le futur pour protéger les Canadiens de d'autres variants. Or, la semaine dernière, il y a des médecins spécialistes en infectiologie qui ont dit que les mesures aux frontières avaient été inefficaces pour contrer l'arrivée de variants, ne serait-ce que pour la retarder de quelques jours. Alors, comment pouvez-vous encore considérer ramener ces mêmes mesures-là si, visiblement, pour atteindre l'objectif d'empêcher l'introduction de variants, ça ne fonctionne pas?
Bien, merci beaucoup. Premièrement, on l'a entendu à plusieurs reprises et l'Agence de la santé publique l'a dit aussi à maintes reprises, une frontière ralentit l'importation de cas et de variants, n'arrête pas complètement ces importations de cas et de variants. Alors, quand les variants changent rapidement, comme on l'a vu avec Omicron en dehors du pays, les mesures et que les cas sont nombreux en dehors du pays, c'est là que les mesures à la frontière sont les plus importantes. On a pu constater au cours des dernières semaines qu'il n'y avait plus de nouveaux variants qui rentraient au pays. C'était du BA1, BA2, BA4 et BA5 qui sont déjà très présents au Canada. On a pu constater avec les données que les taux d'infection des voyageurs entrant au pays étaient très semblables au taux d'infection des Canadiens de manière générale. Donc, comme on disait, ce n'est plus l'importation de cas et de variants de l'étranger qui explique la transmission de la COVID-19 au pays. Alors, donc, c'est à la fois aligné avec ce que les experts disent depuis toujours et aussi informé par ce qu'on a pu observer au cours des dernières semaines. Mais je terminerai en disant que, comme vous l'avez entendu, et comme on a dû le faire malheureusement avec Omicron en décembre dernier, il peut arriver que de nouveaux variants ou que la situation épidémiologique à l'extérieur du pays nécessite que le gouvernement canadien intervienne pour protéger la sécurité des gens. Le contrat social qui lie un gouvernement avec ses citoyens, c'est un contrat social qui repose, entre autres, sur l'engagement d'un gouvernement de protéger la sécurité des gens. Protéger la sécurité des citoyens, c'est une des plus grandes responsabilités d'un gouvernement. Alors, s'il fallait le faire à nouveau, bien, on le ferait. Et c'est pour ça que ces mesures ou d'autres mesures pourraient être utilisées dans le futur si jamais la situation le demandait. Personne n'espère le faire, mais s'il fallait le faire, il faudrait que nous le fassions.
OK. Et en suivi, revenir sur la question, est-ce qu'on est toujours en pandémie? Vous avez dit qu'en effet, il y a encore des cas de COVID dans les hôpitaux. C'est encore une situation qui est importante. Mais est-ce qu'on peut dire à ce point-ci qu'on n'est plus dans un stade de pandémie, que même si la COVID est toujours présente parmi nous, c'est encore un enjeu, on n'est plus dans un stade pandémique, on est passé à une autre phase?
Dr. Njoo, est-ce que vous voulez peut-être préciser les aspects de définition de la pandémie?
Oui, je peux vous dire qu'on a dépassé, je pense, d'après moi, la phase aiguë de la pandémie. Maintenant, c'est sûr que le virus continue de circuler ici au Canada, mais aussi partout dans le monde. Donc, je pense qu'on continue à évoluer avec le virus avec les variants continuent à évoluer. Et c'est toujours important pour nous autres aussi de continuer aussi d'être prêts à répondre à l'évolution du virus. Donc, je pense que c'est toujours une question de continuer avec nos efforts, l'ensemble avec nos outils de surveillance ici au sein du pays. Maintenant, avec les systèmes de surveillance, on suit étroitement toujours qu'est-ce qui se passe avec les hospitalisations, mais aussi avec qu'est-ce qui se passe avec les eaux usées dans plusieurs communautés partout dans le pays. Donc, je pense qu'on est dans une bonne position de détecter s'il y a une recrudescence ou peut-être aussi l'introduction, émergence d'un variant préoccupant et on est toujours prêt à réagir. Merci.
Merci beaucoup, Dr. Njoo, messieurs, madame les ministres. Merci aux collègues pour les questions. That puts an end to this press conference. Thank you. Have a good day.
Merci.